Welcome back to CBS Mornings, and this morning we are looking at the collapse of hospitals serving some of America's most vulnerable patients. It's at the center of an 8-month CBS News investigation into why essential facilities are being shut down at such an alarming rate. And what we found is investors making millions of dollars while communities are left without a crucial health care provider. Our chief medical correspondent, Dr. Jon LaPook, is here with the latest. John, good morning.
Good morning, Tony. Last November, our cameras were there the day 95-year-old Delaware County Memorial Hospital in Pennsylvania closed its emergency room doors for good. With the hospital still shuttered, we returned to Delaware County to see the impact.
Chief 108, I'll be en route to Garfield.
For the past 43 years, this corner of Delaware County, Pennsylvania, has relied on the familiar face of veteran paramedic Jim McCants.
All right, Jimmy.
Good to see you.
So when one of the area's largest hospitals, Delaware County Memorial, shut its doors for good, McCants took it personally.
A lot of nurses I know, PAs, physicians, it's their life calling. It's really what they wanted to do. And then just to be betrayed like this.
You feel betrayed?
Yeah, absolutely I do. And so does, I'm sure, everybody else in this line of work feels that way over what they did.
They are Prospect Medical Holdings, the Los Angeles-based company that purchased Delaware County Memorial in 2016 with the help of private equity investors and a promise to dramatically expand service to the community. But last November, the hospital shut down. We were there the morning 28-year-old Cecilia Vizuete was turned away from the ER. She was having trouble feeding her 1-year-old daughter because of a breast infection. They said I should look on Google Maps for another hospital. Inside Delaware County Memorial, the hallways and patient rooms, normally bustling, were empty except for a few nurses charged with cleaning the place out. Angela Napolitano worked there for 41 years until the day it closed.
It was a sad day. Sorry. It was a very sad day.
When we recently returned to Delaware County, Jim McCants told us the impact had rippled beyond the nearly 85,000 residents the hospital once served.
It's put pressure on the entire healthcare system, the EMS system. Everybody's feeling this. This really hit hard.
Have a car to start to the ER 501 Lansdowne for a walk-up shooting.
In January, 2 shooting victims arrived at the closed ER.
Leave room for the ambulance.
911 audio obtained by CBS News revealed they had to be taken by ambulance to Lankenau Medical Center, nearly 5 miles away.
On the way to Lankin.
McCann said nearby ERs are slammed, and his call volume is up about 25% because he is covering more territory. His team of 16 medics now needs to spend more time taking patients to hospitals farther away.
Where does this end up leaving the people of this community?
They're stranded for healthcare. It did hurt them. It's going to continue to hurt them. It's going to cost some of them their lives.
The closure hasn't hurt everyone. A CBS News investigation has learned of a series of financial moves that enriched Prospect Medical Management and its private equity backers. In 2018, Prospect Medical's owners took out a $1.12 billion loan and paid themselves a $457 million dividend. Sam Lee, the CEO of Prospect Medical, took home about $90 million.
You found a way to navigate you making money and leaving those people in the lurch. That's what they did. It's criminal. Morally, ethically, it should be legally.
But it is legal, and Prospect Medical then paid off the loan by selling off the land and buildings of most of their hospitals to a Birmingham, Alabama firm called Medical Properties Trust.
Just put simply, they bought the real estate out of Prospect and leased it back to Prospect.
Rob Simone, an analyst at a Connecticut-based investment research firm, says Medical Properties Trust is where private equity investors turn their hospital real estate holdings into cash. The publicly traded company has built a portfolio of nearly 200 U.S. hospitals, often in low-income communities.
These are hospitals where care is needed, care is required, and there may be only one option.
Simone has advised clients to bet against Medical Properties Trust, but told us he doesn't trade on the company himself. On its website, Medical Properties Trust says it's at the very heart of healthcare. But Simone says the firm has saddled several of its hospitals with unsustainable rents.
Hospital systems are struggling and individual hospitals are closing in some cases, which is very problematic.
That's what he says happened in Pennsylvania, where Prospect Medical must pay $35 million a year in rent, money that comes out of hospital operations, to Medical Properties Trust.
Here's the hospital we're talking about.
During our return visit, we drove by Delaware County Memorial.
Place used to be packed. It was bustling. Where did they all go?
Prospect Medical says it plans to turn the hospital into a behavioral health facility. It says its rent obligation here in Pennsylvania to Medical Properties Trust was not a factor in that decision. The doors remain closed.
What would you say to the people who are trying to keep the hospital closed?
Where's the responsibility? You took the responsibility for a healthcare system. You can't just drop that.
In a statement, Prospect Medical said it hadn't been notified of a significant increase in EMS response times or if other hospitals have been significantly impacted due to the closure. CEO Sam Lee declined an interview and to answer our detailed questions, as did Medical Properties Trust, the firm that bought the hospital real estate. In a statement, it said it has no involvement in operational decisions at the facility it owns and denied its lease agreements have caused any of them to cut services or fail. Tomorrow, we'll show what happened at Delaware County Memorial raises questions about closures elsewhere.
I mean, it just begs a question about equity here. I can't imagine this happening in Beverly Hills or Greenwich, Connecticut, or any of these affluent places in this country.
Gayle, that's exactly what a Delaware County official said to me. She said, this would never happen in a more affluent community. And the other thing that this raises is the question of transparency. So, you know, you could say this hospital, it was in trouble, it was in danger of failing when it was bought. So they said, the company that bought it said, all right, we're going to sell off the hospital, the land, the buildings, and we're going to use that money to reinvest it into the hospital, and hopefully we'll save it, right? Except it turns out that's not exactly what happened. We would never have known, except for Attorney General Peter Nerona from Rhode Island invoked an unusual law there to open the books of Prospect Medical and found out about that $457 million dividend. It had paid itself. Wow. We would never have known about
Somebody
that.
gets $90 million. Last time you were here, we were saying, is this an anomaly? You know? How often does this happen?
You said that. Is this an anomaly? And we heard you, and we continued the investigation, and we went to San Antonio. We'll tell you about that tomorrow.
Looking forward to that.
That's a tease. That's a good tease.
Great reporting. Dr. Jon LaPook, we appreciate you.